Hi, I'm Dr. Anton Janssen van Rensburg. My last condition that I'm going to speak about is nausea caused by chemotherapy. There's substantial evidence for the use of medicinal cannabis in this condition, CINV. Remember now, you need THC for this. It's the THC that communicates in the brain when it comes to nausea and vomiting. So in this patient example, Maria, 69-year-old female, she's currently receiving her chemotherapy for breast cancer, and she's on a type of chemo that is causing severe nausea and vomiting. And so how you're going to handle Maria is very specific. We actually treat the night before. We start the night before the chemo session, then 1 to 3 hours before again. And then after that, and this is where the patient's going to have to titrate. This is a rapid titration. So we don't have the luxury of 3 weeks of titration here now. We need to titrate on the spot, on the day. And so her titration will look something like this, where there you see it's 2 drops, but then 2 hours later, if she doesn't feel the nausea and vomiting getting better, she will start increasing this dose. Now, there are very complicated ways how you can actually even pitch a dose here, where they look at the Dubois formulas for meters squared of body surface. But when I found with medicinal cannabis as a medicine, that allowing your patient to titrate is the best way to do it, because then after this, with the next chemotherapy session, this is what your patient is going to be able to do. They're going to know what their dose is and where they are going with their dosage. Okay. Right. So if the 1-1 doesn't work in a patient like Maria, then obviously you can upgrade to a THC dominant product using the same principles. But remember now, these patients aren't going to drive. This is the one condition where you are going to be using more THC, and it can be as high as 50 milligrams per day. And you must be very careful that you explain to the patient that they can't drive on dosages like that. But if it takes 40 or 50 milligrams of THC for that patient not to have nausea and vomiting, then that is the dose that you're going to have to work towards.